A very good morning to all of you. I am Dr. Mala Dharmalingam. I am Professor and Head Department of Endocrinology, Ramaiah Medical College, Bangalore. I also am the Director of Bangalore Endocrinology Diabetic Research Center, also situated in Bangalore. Today I am going to talk to you about a few facts about thyroid. Thyroid is a very common problem, as you all might have known. And if you ask any family, there may be a person or two with thyroid disorders. It has been increasingly common nowadays, possibly because of the awareness and the testing, and also possibly because of stress and increased use of endocrine disruptors. To put it simply, what are endocrine disruptors? They are problems associated with the environment which cause endocrine problems, and one of it is plastics. So these may be the ones which influence the increase in thyroid problems we face today. So now many people ask me, what is the main cause of thyroid problems? Of course, there are two major causes of thyroid. One is hypothyroid and one is hyperthyroid. Hypo meaning less and hyper meaning more. The more common of the two is the hypothyroidism. Both of these problems are largely due to the fact of autoimmunity. What is autoimmunity? Auto means self and immunity is the immune system in your body. The immune system can get disrupted because of some infections or due to stress or some other factors which cause the immune system to get excited, in which they may either destroy the thyroid gland or in fact activate it to cause more hormone, wherein you would get hypothyroid or hyperthyroid respectively. The other common associations of thyroid is a goiter. What is a goiter? Goiter is any swelling of the thyroid gland. You might have seen also that people have a swelling in the lower part of their neck, which is something like a butterfly, which is the thyroid gland. If this enlarges, it is called goiter. Part of it may enlarge as a nodule when it is called nodular goiter. This goiter may be, or this nodule may be single or it may be multiple when it is called solitary nodule or multinodular goiter. Not all swellings or goiters may be functional or having hypothyroidism. Some of them may be there and the functionality of the thyroid may be completely normal. So you may have a structural problem or you may have a functional problem or you can have both. Structure is whether it's enlarged or not, that is the thyroid, and function, does it secrete the hormone correctly? Is it secreting less or secreting more? So now the question comes, is this problem more common in women or occurs only in women? No, it doesn't. It can occur with anyone. So it occurs more commonly in women because these autoimmune problems are more common in the reproductive age group of women, and that is why it is common in women. But today in my own practice, I see a whole lot of men coming with thyroid problems, especially hypo and hyperthyroidism, and in fact, it can come in children also. Hypothyroid can start from infancy or at newborn, called congenital hypothyroidism, or it can happen in the childhood where it's called juvenile hypothyroidism, and then of course it can happen in adulthood and older people, which is called normal primary hypothyroidism or even secondary hypothyroidism, where the cause can be from the pituitary gland, which is situated in the brain. So the question comes is, what is the function of the thyroid gland and how can I recognize if it is functioning properly or not? Thyroid gland secretes a hormone called thyroxine. Thyroxine is a metabolic hormone and it is required for every part of your body, right from thinking to physical functions, activity. It is a very, very important hormone for the metabolism of every cell. How to recognize? A high degree of suspicion is required because the symptoms may be a little ordinary or vague, something like putting on weight, feeling lethargic, not able to concentrate, memory reducing, hair fall, which are quite common problems, may be the presenting symptoms of hypothyroidism. The very opposite of this would be hyperthyroidism, where the metabolism increases, where you may lose weight or have palpitations, or fingers may be shaking, which we in medical terminology call tremors. There may be increased motions. In hypothyroidism, there may be constipation. So these are some of the common symptoms that we see in hypothyroidism per se. And in hyperthyroidism, we have increased metabolism. So the thyroid hormone functions in all the aspects of our daily life. Can this be cured? Unfortunately, no. This is an autoimmune problem. Though we do see some 5% to 10% of population becoming normal with time, this is not a curable disease with tablets. It is, however, a very well controllable disorder. You need to take your thyroid medication correctly. And if you take it correctly, your thyroid hormones will be normal, and then there is nothing to worry about if your thyroid is well controlled. But you do need to take this regularly and in a disciplined manner. Does stress affect thyroid? Yes, it does. If you are stressed, your thyroid hormone function may further reduce and your thyroid requirement may increase. However, if you test in severe stress levels, the reports may come abnormal. Like if you are in an ICU setting or admitted in hospital, then the reports will come wrong, and we redo the test once the person is discharged and then see. But otherwise, a normal stress levels can increase the requirement of thyroid hormones, and the thyroid levels in the blood will also alter. And does hypothyroid get worse over time? Many people do come and ask me, do I need to take the tablet lifelong? What will happen if I don't take the tablet? So though I always say that hypothyroid is such a simple problem to take care and to get treated, however, if you don't treat it correctly or don't recognize it correctly, it comes with its own problems. What are the problems? Since I told you it's a metabolic hormone and it affects every system. Many people come and ask me, does thyroid worsen over time? What will happen if I don't recognize it or don't treat it? So, in fact, though thyroid is a very simple problem, not recognizing or treating it on time or getting it evaluated on time can cause a lot of problems. Initially, the symptoms are a little vague, like I told you, that someone may put on weight and be a little tired, fatigued, not able to do the work, or may say with time, they will say that I forget whatever to do what I have to. Memory sort of comes down, and even at that point, if you don't treat, patient may become drowsy and lethargic, and it can also end in a myxedema coma. That means hypothyroid becomes so severe that patients go into coma or even psychosis. I do want to mention here that a common symptom that people have is called obstructive sleep apnea. What is this obstructive sleep apnea? If you are snoring, it may be because of hypothyroid itself. And what happens here, there is a tongue enlargement which actually falls back, and the air going to the brain becomes less, and thereby the oxygen saturation of the brain is less, and person does not feel well. He may get up with a headache, or which is called an early morning headache, and feel sleepy through the day, which is called daytime drowsiness. So these are some of the problems if you don't treat thyroid adequately or don't recognize it early enough. The other things that it can cause are that it can affect the heart. The heart, in fact, gets enlarged, which is called cardiomegaly, because even the heart requires thyroxine. And if you don't give it thyroxine, the heart will enlarge and the person will feel breathless when they are walking. It is required for the respiratory system, where again there will be a breathlessness if they are not treated adequately. It is required for the gut, and if you are not giving correctly, the colon enlarges, which is called a megacolon, and then you can have lot of associated problems with that. So the other question that comes is, the other common problem that we have in endocrinology is diabetes. Is diabetes and thyroid associated? Yes, because if you treat thyroid very aggressively, then you may precipitate diabetes. Even otherwise, hypothyroid is associated with something which is called insulin resistance. What is this insulin resistance? Insulin resistance is the insulin in the body, which is secreted from the beta cell of the pancreas, is not working as well as it should. So you require more insulin to control the glucose, and this can lead to diabetes. So hypothyroid and diabetes are associated, and we actually call them, they are like sisters and they go hand in hand. So it's important for every hypothyroid to also keep this in mind, that they may become diabetic later, or it may come along with diabetes, and this is something that one should understand and check for on a regular manner. Any other problems that can happen? Yes, cholesterol. This, in fact, hypothyroid can be one of the causes of the cholesterol going high. So when cholesterol is high and we don't find any other reason why cholesterol is high, we often ask patients, please check your thyroid. It may be because of your thyroid that your cholesterol is high. So it's very important, when you are diagnosed hypothyroid, you should also have your lipid profile done as well as your blood glucose done. These are some things which are important. Sometimes hypothyroid can also have kidney function abnormalities. But the nice thing about this is that once you are treated for thyroid adequately, all these other problems will subside and you will become completely normal again. And the question comes as, does anything interfere with thyroid absorption or the thyroid hormone itself? Yes, it's a very, very important question. When should I take the tablet, and what is the precaution that I should adhere to when I'm taking the tablet? The tablet should be taken first thing in the morning. I usually tell them to take it as early as possible, preferably before 7 o'clock, and there should be a gap of an hour before breakfast or any other beverage. However, coffee and milk, that is caffeine and milk, interfere with thyroid absorption, so they should be taken a minimum period of 4 to 5 hours after taking thyroid tablet. Is thyroid inherited? Is it genetic? Does it happen in families? Yes, thyroid can happen in families, though not all the time. We do see families where almost 3/4 of the members have thyroid problems, and we also see patients coming and telling, sir, madam, I don't have any person who has thyroid in the family. Yes, because of the autoimmunity, it may not happen that there is a person who has thyroid in the family, but there are also families which can have autoimmune itself as genetic problems. So some may have hypothyroidism and some other people may have hyperthyroidism. So it's very important that each one of us should understand, be cautious, and be aware that there is a problem like this. And if any of these symptoms exist, one should go for a test, for thyroid hormone function test, which is commonly called T3, T4, TSH. And I would definitely like to stress here that in pregnancy, one has to routinely get it done, even if they don't have symptoms, because this is a period where the thyroid hormone from the mother has to get transmitted to the baby, and it's very important that the thyroid hormone tests are done at that time and they are within normal levels. I'm going to talk to you about hyperthyroidism. It is a condition in which more thyroxine is secreted compared to hypothyroidism, where less thyroxine is secreted. This is a little uncommon problem, but the reason I thought I'll speak to you about it is for the fact that it can be easily confused with other problems, and you may not get referred or even tested for thyroid thinking it's other problems and being misled to be testing for other diseases and not diagnosing it correctly. So how can it present? It usually presents with palpitation, which means you're conscious of your heart beating, And sometimes it can have missed heartbeat or very, very fast heartbeat. The other problem is weight loss. Suddenly you have found that you're losing 2-3 kilos over the 1 or 2 months and you don't know why. And there may be problems of frequency of passing motions. So these are 3 very common problems associated with hyperthyroidism, apart from the fact that your fingers may start shaking, which we call tremors. Many times people are admitted in the wards for temperature which is not coming down or fever which is not coming down, and we don't have a cause. This we in medical terminology call pyrexia of undetermined origin. Pyrexia meaning fever. So one of the causes of fever not being diagnosed correctly is thyroid. The other common problem which thyroid is mistaken or hyperthyroid is mistaken for is cardiac disease because of the palpitation and skipped beating, which we call atrial fibrillation. It can actually lead to heart failure, and patients very often get admitted under cardiologist in the cardiology ward thinking it's a cardiac problem, but actually it is due to hyperthyroidism. Unexplained weight loss. People may be giving you vitamins, protein drinks, thinking that you're losing weight for some reason, but it may be hyperthyroidism. So if you have any of these symptoms of weight loss, palpitation, tremors, please think of hyperthyroid, because hyperthyroid, when you're diagnosing it, can be treated well and completely and may be even cured of hyperthyroidism. So how do I diagnose hyperthyroidism? One has to do a T3, T4, TSH, and T3, T4 will be elevated and TSH will be reduced in a patient with hyperthyroidism, because TSH is thyroid stimulating hormone which is secreted from the pituitary gland, and because it understands that the thyroid gland is overfunctioning, it is suppressed and there is no TSH secreted. This is typically how your thyroid function will look. To confirm whether it is thyroiditis or it is Graves' thyrotoxicosis or a toxic nodule, your doctor will ask for a nuclear scan, which is usually a technetium scan, and with that they will be able to diagnose you correctly and give you the correct modality of treatment. In any medical disorder, there are a lot of myths. There is Google, and everybody is a lot confused with what is the right knowledge. It's very important that knowledge should be right and should be pertaining to us. What are the common myths in thyroid disorders? The minute someone sees that there is a swelling on the thyroid gland, that is in the neck, which we call a nodule, many people get scared that this is cancer. Cancer, of course, is a dangerous problem, so the worry is genuine. However, one has to know that all swellings need not to be cancer, and even in a thyroid nodule, it's less than 5% of the time where it will be cancer. So if you have a nodule, don't neglect it. Go to your doctor. He will possibly do a scan and do a needle test, and in which they can diagnose, and most of the time it will be what we call benign, which means there is nothing to worry about. The other myth is that if I take extra medication of thyroid, which is thyroxine, it will be more active because it's a metabolic hormone. No, it is not true. You should take the hormone on the correct dose, because either over-medicating or under-medicating can cause problems. If you're over-medicating, you will become hyperthyroid, which is again not good for your heart, and your bones will end up becoming very weak, which is called osteoporosis. So it is very important that you should check your thyroid on a regular basis and see that you're not either medicated overly or less. It is important to keep your thyroid in the normal level. The other myth is, can you have symptoms of thyroid though the thyroid hormone is a normal level? This is something which is commonly asked, and people have said that at cellular level the thyroid may be less, but it is not true. if your thyroid hormone is normal, you may have some symptoms, but they will not be related to thyroid gland. So then you will have to think, what is it related? Being, let's say, for example, you're continuously putting on weight in spite of your thyroid hormone being normal, then we should understand, is there something wrong with our lifestyle? Is our diet okay? Is our physical activity okay? And why am I feeling putting on weight? And the other common problem is feeling tired. So if you're continuously feeling tired in spite of your thyroid hormones being normal, you should definitely look, am I having low blood count or low hemoglobin, which we call anemia. The other myth is that thyroid problems happen only in older women. It's not true. Thyroid problems can happen at any age. It can happen in the newborn, to infancy, to children, to adults, and of course in older people also. It is more common, however, in people more than 50 years of age, and it is important that they should test for thyroid if some of the symptoms are present. It's more common also in women who are more than 50 years of age, but it can happen to everyone. So a high degree of suspicion is required to understand that whether we are suffering from thyroid disorder or not. The myth is that all people with thyroid have bulging eyes. This is again not true. Again, as I have said before, thyroid can happen in two ways. One is hypothyroid and hyperthyroid. In hyperthyroid, there may be eye bulging, which is called Graves' disease, and this is a different condition, and it's not true that in hypothyroid there will be bulging of the eyes.